So today's topic is specific inflammatory processes of the maxillo-facial area. It means we're gonna learn something about actinomycosis, tuberculosis, and syphilis. Of course, gonna remind, I guess you passed that subjects on other. Mm, not that subject. You pass that topics on other subjects, okay, such as microbiology and others. But we're gonna take a look on all those specific processes that take place in our region. It means maxillofacial area. Okay, so syphilis and tuberculosis are serious and dangerous diseases, of course, the prevalence of which is largely related to social factors. Unfortunately, in recent years, tuberculosis and syphilis have become increasingly common in the maxillofacial region. Thus, the ability to correctly and timely diagnose these diseases, prescribe effective local treatment, and refer patients to specialized medical institutions are mandatory for the training of a dental surgeons. A dentist can be the first to, so we saying that introduce, but of course it's understandable, a patient to a specific process in the maxillofacial region. So it means that we, as a dentist, yes, we can see any signs of those specific processes. First, even patient could not know about those problems. So it means this. Tuberculosis is a chronic infectious disease caused by Mycobacterium tuberculosis. The causative agent of tuberculosis is acid-resistant mycobacteria from the Mycobacterium tuberculosis group complex. We talk about Mycobacteria tuberculosis, Mycobacteria bovis, and Mycobacterium africanum. The disease is spread by patients with an open form of tuberculosis of the organ's breath. I guess it should be of breath organs. It means pulmons, right? Mycobacteria released during coughing can enter the respiratory tract by droplets of with dust or with dust, be swallowed, get on the skin or mucous membrane by contact, and other ways. In the development of tuberculosis, the immunity and resistance of the body of Mycobacterium tuberculosis is of great importance, as well as the functional state of various organs and systems, such as nervous system, central nervous, endocrine system, and others, living conditions, work, nutrition, and life of the patient, as factors of the external environment play an important role in the formation of human adaptation mechanisms and leave an imprint of the development of the disease. Tuberculosis can affect any system and organ of the body while remaining a general disease. Here you can see the pathomechanism of the infection process. It's absolutely typical for any microbiological agents, but here is described mycobacteria. So we have in our region, in our maxillofacial region, we have injuries and at tuberculosis are many different tissue types, right? We have a mucous membranes. It means tuberculosis of mucous membranes. We have tuberculosis of jaw, of skin, of subcutaneous tissue, lymph nodes, and salivary glands. The primary tuberculosis lesion is usually formed in the area of the lymph nodes. According to the author's observations, the submandibular, upper cervical, parotid, and submandibular nodes are more often involved in the pathological process. An exogenous infection can enter the lymph nodes through the skin of the head and face, mucous membranes of the gums, cheeks, and nasopharynx, through the tonsils of the lymphoid pharyngeal ring of Valdayer, I suppose, because I'm sure that no one used Pirogov name for that. But here we say in Pirogov pharyngeal ring. It is observed most often in children and young people. Lymph nodes at the beginning are enlarged, dense, not painful. The skin above them is not changed. Over time, they soften. Fistulas are formed. In about half of the cases, there are also changes in lungs. Tuberculosis of the skin, large vessels, or bone marrow are observed very rarely, but tuberculosis can affect any organ, and here you can see some examples of that problem. Of course, we understand that those patients not gonna address in your dental office. Damage can heal independently by fibrosis in people with a violation of cellular immunity. The release of these caseous masses, extremely intensive reproduction of the pathogen, and the formation of cavities are observed until a specific immunological response develops. Macrophages filled with phagocytosed mycobacteria can enter the bloodstream through the lymphatic system and cause bacteremia. This way, microbacteria get to many organs but remain in places that are comfortable for them. Microbacteria can remain in the human organisms for a long time. We call that latent infection, and even after many years, cause pulmonary tuberculosis or extrapulmonary tuberculosis. Here you can see some forms of signed tuberculosis in our organism, starting from primary tuberculosis of the skin that we call chancre. Not sure how it sounds in English, but chancre maybe, tuberculous chancre, right? And we have scrophulodema and till some rosacea-like tuberculate and papillonecrotic tuberculosis. Any of those forms could be on our patient, of course, but everything caused just by one microorganism that called Mycobacteria tuberculosis. Tuberculosis of the mucous membrane of the oral cavity is characterized by a hemorrhagic symptom in the form of petechia. Primary tuberculosis of the oral cavity and lips, an isolated tuberculous lesion, is practically not found due to the fact that the oral cavity is less susceptible to Mycobacterium tuberculosis. Let's move on. Tuberculous lupus, or lupus vulgaris in Latin, right? Is the most frequent form of secondary tuberculosis lesion of the maxillo-facial region. And here you can see the example and how medicine described it. We have lupus, right? It is the main primary element of tuberculosis. And here you can see how we describe it on the maxillofacial area. I'm not gonna read that because it's pointless. I mean, for now, but you should know that you can see the first one. No, you could be first doctor who will notice those that primary element. So you should recognize it on the patient. I'm not sure um, about how far dentists in UK do their practice. I mean, how wide options you have, or maybe you just treat the cavities and that's it. Because here we have a stomatologist master degree, okay? So it's more wide notion than just dentist. So it's just I'm just
Yeah.
trying to explain why we learn about tuberculosis here.
Mm.
And of course, here also, we're not gonna treat patients with tuberculosis. All that we do, we just making some plastic surgery or removal all those sign of tuberculosis in maxillo-facial area, but generally we're not going to treat tuberculosis in an organism because it should be some protocol of tuberculosis treatment. And of course, that's not our problem. I mean, dentist problem. Okay, let's continue. Miliary ulcerative tuberculosis, I suppose, is a variant of the secondary tuberculosis lesion of the mucous membrane of the oral cavity, which develops due to reduced immune resistance. And that is very important thing about immune resistance. Um, Tuberculosis is a disease that stick on patients that have really bad immune status. So if you have a very nice immune system, I mean, when it works nice, it's very low possibility that you're gonna have tuberculosis because our immune system very know what to do with tuberculosis. I mean, with Mycobacteria tuberculosis. Okay, typical tuberculous nodules appear, the further development of which is accompanied by disintegration in the center and the formation of the shallow, initially small, with uneven, undercut, soft edges. And the description of those sign on the mucous membrane or on the skin, or that ulcer, I recommend you to take a note about that because in our examination that calls CROC, right? There is a many tests about ulcers. So one of those ulcers is tuberculosis. So you have to distinguish them very good. Okay. It describes the how it looks. It is yeah, the bottom and edges of the ulcer have a granular character covered with a yellow-gray coating. That's very important to remember. Okay. Cultivative tuberculosis, or we call that scrophulodderma, is a rarer form of secondary tuberculosis which occurs mainly in children. A typical feature of this form is the formation of knots in the deep layers of mucous membrane which eventually disintegrate. At the same time, ulcers of an irregular shape, soft consistency, with eaten, undercut edges. Not sure if you use that word eaten, but I just don't know how exactly to translate that. Undercut edges and flaccid granulations at the bottom of the ulcer are painless and, when healed, uneven, so-called shaggy scars are formed. Tuberculosis of the jaw. Could be with bone damage with primary tuberculosis complex, and could be bone damage with active pulmonary tuberculosis. Tuberculosis of the jaws occurs secondarily. That is when the process passes from the mucous membrane of the oral cavity or during hematogenous or lymphogenic spread of mycobacteria from various organs and tissues. Radiologically, rarefaction centers with an indistinct or blurry, or on the contrary, compacted or clear borders appear in the jaw. In the cells, inclusions of different densities can be determined, and we call that process sequestration. And when we move it, we call that sequestrectomy. Okay, that's very hard to explain that because you should see exactly the X-rays of those patients. And also, we have areas of osteoporosis can have different sizes. Clinically, tuberculosis of the jaws resembles chronic osteomyelitis with the presence of fistulas or ulcers. Mycobacterium tuberculosis can be found during cytological examination of pus or the surface of ulcers. Tuberculosis of the salivary glands is rare. The disease occurs when the infection spreads by contact, hematogenous or lymphogenous. The process occurs more often in the parotid gland, rarely in the submandibular and sublingual glands. Ultrasound of the parotid area indicates enlarged parotid salivary gland with the hypoechoic round continuous lesions in the structure of the parotid gland with the absence of calcification and cystic degeneration. Tuberculosis of the cervical lymph gland accounts for almost 80% of all cases of peripheral lesions, which is also associated with the corresponding routes of infection entering the human body through the oral cavity and respiratory organs. Tuberculosis mycobacteria can settle and linger on the mucous membranes of the nasopharynx, oral cavity, palate, and on the tonsils. In these cases, they enter the regional, cervical, and submandibular lymphatic glands with the flow of lymph. The danger of tuberculosis of the lymphatic glands is that their single lesion occurs as an exception, increasing and merging with each other. Groups of glands from packages. Lymphatic glands located on different floors of the lymphatic system are often affected. All this complicates the diagnosis of diseases, complicates treatment. And here I found some picture of when you can see the example, how it could be. Look on the real patient. It's tuberculosis of extramaxillary lymph nodes. Clinical picture and typical course. Systemic symptoms may appear regardless of the localization of pathological changes. Increased body temperature, loss of appetite, weight loss, night sweats, malaise. Blood analysis. Usually the result is normal, sometimes leukopenia or leukocytosis, anemia. Okay, so let's say that we have low level of potassium in the blood, because I'm not sure if hyponatremia exists. Okay, so it means low level of potassium in the blood. And hypocalcemia, I guess it's comprehensible. And of course, we could have some auxiliary studies. Let's talk about treatment. Of course, we use anti-tuberculosis drugs. There's the basic drugs in the first slide. You can see here the examples. And the second line drugs, it could be useful in treatment. As I said before, that's not a dentist doing, okay? So it's a generalist, or how you call them, it's just general doctors should treat tuberculosis. I mean, according to some protocols that you use in your country. I'm not sure that you use same drugs for that. What we doing as a dent or as a stomatologist here, we just deal with sign of tuberculosis in our area. So we should remove it and do some plastic surgery or reconstructive surgery and other things that we could do, but we're not treated tuberculosis here. Actually, it says about that general treatments is carried out in specialized physiatric clinics institutions. That's what I tried to say. And of course, prevention of the tuberculosis, early diagnosis and treatment of tuberculosis patients, prevention of nosocomial infection, and tuberculosis vaccination. That's very important. So we're gonna switch to another disease. That disease called actinomycosis. So actinomycosis is a chronic disease of humans and some farm animals, which is caused by special gram-positive bacteria, actinomycetes, which were previously classified as a pathogenic fungi, so-called radiant fungi. Actinomycosis is a chronic localized or hematogenous anaerobic infection caused by actinomycetes riley and others. Clinical manifestation: local abscess with numerous draining sinuses, tuberculosis, pneumonitis, and mild systemic symptoms. Diagnosis is based on typical appearance plus laboratory identification. Treatment is carried out with a long course of antibiotics and surgical intervention. Epidemiological features: animals become infected by eating poor quality fodder, and human when pathogens enter through damaged areas of the mucous membrane of the oral cavity or skin and begin parasite. In the external environment, actinomycetes are found in soil, straw, reservoirs, and bottom sediment, where there is in fact increased content of organic substances. Their colonies have an irregular shape and radiant edges. In pathological samples, they are present in the form of drusen, yellowish lumps, the diameter of which does not exceed 2 millimeters. Microscopy shows mycelium threads in the center of drusen and swelling in the form of patholes at the edges. Depending on the localization of the pathological process, 9 types of actinomycosis are distinguished: cervical facial, spinal, nerve, abdominal, skin, bone articular, bronchomycosis, pneumomycosis, and generalized. However, many, if not most, infections are polymicrobial. with other bacteria, oral anaerobes, staphylococcus, streptococcus, and others. Actinomycosis is the most common in adult men and has several forms. As we said before, cervical facial, the most common source is periodontium. Thoracic, lung disease that results from aspiration of oral secretions. Abdominal cavity, the disease is probably the result of rupture of the mucous membrane of the diverticulum or appendix or trauma. Uterus, this localized pelvic form, is a complication of certain types of intrauterine device. Generalized form, rarely the infection spreads from the primary site, probably by hematogenous route, or it means the hematogenous way. The incubation period for actinomycosis ranged from several days to 2-3 weeks. Actinomycosis of the maxillo-facial area is characterized by considerable diversity. The onset of the disease often takes place in a hidden form, not accompanied by pain and an increase in temperature. The infiltrate with wanting lymph nodes appears in the submandibular area and is not connected to the adjacent tissues. In the future, the inflammatory process does not have clear boundaries. It becomes diffuse on palpation. The infiltrate is very dense, usually painless, spreading to a group of masticatory muscles. It causes relatively early treatment. In the latter term, multiple skin and intraoral fistulas appear with characteristic purulent separated structures containing grains of drusen. The thinned skin around the fistula passages takes on a red-bluish hue. Actinomycosis, complicated by secondary infection, is more severe, with high body temperature and intoxication. Cervicofacial actinomycosis, a fistula from a preoral around the ear lesion originating from the sinus tract, is shown, like in this picture. You can see symptoms and sign of actinomycosis. Clinical manifestation, that's more interesting. The appearance of tumor-like inflammatory formations, infiltrates of woody density. Yeah, it could be woody density. Okay, or a bluish-red color in the soft tissues around the jaws, on the neck, less often in the lungs, intestines, and other places. Over time, pus forms and involves the environment fluctuation, and then the development of fistulas. The process is chronic. Actinomycosis of the lip is very rare. A purple nodule with a diameter of 2 centimeters is on the mucous membrane of the lower lip. You can see here that on that picture. He had numerous lesions in the oral cavity and the round, purple, well-defined, very hard nodule with a diameter of 2 centimeters of the mucous surface of the lower lip. There was no regional lymphadenopathy. Differential diagnosis from the fistula ducts. The secreted contents are collected. The extracted biological materials is sent for microscopy. With its help, drusen are detected, actinomycetes. This makes it possible to make an accurate diagnosis. The study of secreted sputum smears from the oral cavity does not allow obtaining a reliable clinical picture. The presence of actinomycetes present in biological fluids taken from their places is also found in healthy people. The immunofluorescent reaction is used to identify the type of radiating fungi. In 75% of cases of the development of actinomycosis, the presence of radioactive fungi in the studied biological materials is not observed. To confirm their diagnosis, in such a situation, a culture of pus taken from the oral cavity or obtained with the help of biopsy is performed. After 2 days, you can already get the first positive results, but the final conclusions are made only after 2 weeks. Carrying out such analysis allows you to access the qualitative and quantitative composition of microflora and determine its sensitivity to antibacterial drugs. Methods of prevention. Prevention is very important thing, because if you do right prevention, you're not going to have those problems. So there is no specific preventions. Of course, we're saying that in medical way, right? Specialists formulate general recommendations and advise to carefully observe the rules of personal hygiene, prevent injury to the skin, timely treat teeth, any other inflammatory diseases of the oral cavity, larynx, respiratory organs, and gastrointestinal tract. Generalized treatment of actinomycosis, the use of antibiotics, X-ray therapy or surgery, multivitamins, and others. One of the methods of treatment of actinomycosis is high doses of penicillin, and some studies suggest that hyperbaric oxygen therapy is beneficial. That really helps. That really helps. And we gonna learn a third one. Disease today is syphilis. So syphilis is a chronic infectious venereal disease caused by pale treponema or treponema, which affects all organs and tissues and is characterized by a progressive course. The name pale treponema was given due to its weak ability to perceive staining. It is a spiral-shaped microorganism, 4 to 14 microns in length and 0.2 to 0.5 microns in width. The resistance of pale treponema to external influences is low. Low temperature does not affect the spiral. The microorganism develops as a facultative anaerobe. They are infected with syphilis from the patient, as a rule, sexually, much less often for kisses, spoons, glasses, cigarettes, and the others. The so-called domestic syphilis. The causative agent of syphilis enters the body through a damaged stratum corneum of the skin or epithelium of the mucous membrane. Congenital syphilis is distinguished. Pale treponemes enter the body of the fetus through the placenta and lymphatic fissures of the umbilical vessels, as well as in the form of an embolus through the umbilical vein. The mother infects the fetus in utero. The most dangerous period of transmission of syphilis from mother to offspring is the secondary period, less often the tertiary period. The spread of syphilis is facilitated by factors: incomplete detection of source of infection and context, self-medication, population migration, drug addiction, acceleration, prostitution, sexual depravity, low level of sanitary and educational and others. In the clinical picture of syphilis, primary, secondary, and tertiary periods are distinguished. Incubation period is 3-4 weeks and ends with the formation of primary syphilis. Yeah, here you can see a real picture of congenital syphilis. Primary syphilis is characterized by the appearance of red spot or papule. Within a few days, this element increases to the size of a pea, and a dense sclerotic infiltrate appears near the base. Necrosis appears in the center of the element, depending on the depth of necrosis. Erosion or an ulcer is formed. In this way, a primary syphiloma, primary effect, hard chancre is formed. Clinically, a solid chancre is characterized by erosion or ulcerization of the rounded shape, painless and half till 1 centimeter in size, with smooth, clear edges which are slightly raised on their healthy skin. Cartilaginous infiltrate near the base. The surface of the erosion ulcer is smooth, red, and shiny. A dense plaque of gray-yellow or dark red color may form on the surface of the hard chancre. Primary syphiloma is usually single, 2, 3, or more chancres appear much less often. The localization of the primary effect on the face is as follows: on the lips, tongue, tonsils, gums, palate, and rarely other localization. The primary period of syphilis begins with the appearance of a pale trypanema of hard chancre, ulcus durum, or primary syphilis on the site of invasion. It is mostly localized on the lips, gums, tongue, and tonsils. The development of the hard chancre begins with the appearance of limited redness, in the center of which a seal appears in 2-3 days due to the infiltrate. In the central part of the infiltrate, necrosis develops and a bright red erosion is formed, rarely an ulcer. Erosion has a round or oval shape, diameter from 3 millimeters to 1.5 centimeters, slightly raised and even edges. It is painless with a cartilage-like infiltrate upon palpation. The bottom of erosion is initially flesh red, dense, shiny, sclerotized, later grayish-white with a fatty coating. Syphilis infection on the face often leads to inflammatory processes and swelling of the cheeks. This type of rash does not occur with syphilis, is considered contagious, but can cause fever and malaise the patient. Syphilitic chancre on the lip. When the primary sign of syphilis on the face the foot were not diagnosed and treated in time, chancres can grow into large, purulent lesions of the skin that emit pus, can ooze blood, and hurt when pressed. The secondary period of syphilis manifests itself on the mucous membrane of oral cavity in the form of roseola and papules. Roseoles or spotting rash mainly occurs symmetrically on the palatal bridges. Soft palate tonsils, its elements can merge into separate areas. They have a stagnant red, sometimes with a copper sheen color and clear borders. Mucous membrane is slightly swollen. Sometimes patients complain on unpleasant sensation and even pain when swallowing. As you can see in the photo, syphilis can develop in the corners of the mouth, provoking the appearance of small cracks and pus lesions. Such wounds do not cause pain and discomfort to the patient, but they can become a dangerous source of the spread of bacteria, the causative agent of syphilis. The most frequent manifestation of secondary, especially recurrent syphilis, is a papular rash. It is mainly localized on the tonsils, palatal arches, soft palate, where the papules merge into solid lesion, as well as on the tongue, mucous membrane of the cheeks, and especially along the line of teeth closure and gums. 5-7 days after the appearance of chancre, regional lymph nodes increase, that is, syphilitic sclerodenitis occurs. Lymph nodes initially increase on the site of lesion and have a dense elastic consistency, and after 3-4 weeks, an increased lymph nodes is noted on the opposite side as well. We call that polyadenitis. The primary period of syphilis is divided into primary seronegative or negative serological reactions and primary seropositive positive serological reactions. The primary period lasts 6-7 weeks before the appearance of multiple syphilitic lesions on the skin and mucous membrane rashes. Secondary syphilis is characterized by the appearance of roseolar papules, rarely pustules on the skin and mucous membrane. At the same time as the skin rashes, there is damage to the mucous membranes. Speckled, papular, and pustular syphilids are distinguished. At the secondary stage of development, syphilis is the most provokes the development of large purulent wounds and abscesses of the mucous membrane of the mouth, which can lead to the development of tumors, inflammations, and cracks. Secondary syphilis of the mouth. During the development of the disease in body, syphilis spots on the face can take the form of large tumors that are brown or red in color and often lead to the spread of infection in the oral cavity. Symptoms of syphilis on the nose. Elderly people can often be diagnosed with syphilis on the nose, which in its advanced form provokes multiple inflammatory processes, can cause burning and purulent abscesses. Blisters on the lips. The initial sign of syphilis on the lips of an infected person due to tears during eating can transform into large purulent abscesses, which often emit pus or blood. And unfortunately, we have a tertiary syphilis. It's extremely rare. So according to the result of scientific and practical studies, in the absence of treatment, tertiary syphilis develops in a third of patients and 25-30% of them die. In the period of tertiary syphilis, all internal systems and organs of a sick person are affected. Spinal cord and brain, nervous system, cardiovascular system, bones, kidneys, liver, intestines, stomach, testicles in a man. Also, irreversible changes occur in the organs of vision, joints, and many other tissues and organs. Tertiary syphilis can last for years and decades, causing the patient blindness, deafness, paralysis of various organs, or mental disorders. This disease significantly and irreversibly changes the human psyche. It means human psychological status, okay? Patients may experience both of rage, depression, or paranoia, which are replaced by euphoria or periods of creative inspiration. Syphilitic are prone to hallucinations and therefore perceive reality as an alternation of light and darkness, or a play of bright and dark colors. Yes, here you can see the result of tertiary syphilis. It could lead to not good transformation of appearance in the human body, so we have to do something with that. And here you can see the examples how people could look with tertiary syphilis. And of course, there's a kind of rehabilitation of those patients. We could use restorative materials. Of course, it's artificial materials, and it fixes, okay, it fixes on the body with some magnets or organic glue or something like this. So there's many methods. Here another example of that. Okay, or you can use real tissues that you can take from patients. So it's same tissues, so that's not going to be problematic for the organism to when you replace it, okay? And here it's some examples of question about our specific inflammatory diseases that you can meet on a croc. Croc, it's examination that you're gonna have in the 5th year. Few words about osteomyelitis. Osteomyelitis is non-specific purulent or purulent necrotic infectious allergic lesion of bone tissue. Status, we could call it like this, bone marrow, and we call it myelitis, periosteum, and we call it periostitis, I suppose, and surrounding soft tissues. Factors contributing to the development of osteomyelitis are bone trauma, colds, overwork, vitamin deficiency. And during the microbiological examination, Staphylococcus aureus is the most often isolated in the patients with hematogenous osteomyelitis and in patients with a post-traumatic osteomyelitis. Associations of gram-negative and gram-positive microorganisms, less often anaerobic flora. In chronic osteomyelitis, the flora is represented by both gram-positive and gram-negative microorganisms, as you can see. So the most likely microorganism that cause osteomyelitis of the jaw you can see on that list. And we could talk about chronic hematogenous osteomyelitis. Yeah, we have 5 minutes. The use of antibiotics and early osteoperforation in a significant percentage of patients make it possible to achieve good results in the treatment of acute osteomyelitis. In the remaining patients, it becomes secondarily chronic. At the same time, after the subsidence of acute phenomena, a person can feel satisfied and engage in usual work. But after some time, under the influence of provoking factors such as hypothermia, injury, malnutrition, others, the disease relapses. In the affected area, pain returns, swelling, hyperemia of the skin appear, body temperature rises. All this indicates that a latent infection has been activated in a bone thus is forming. After its opening, independent or operative, the patient's condition improves, body temperature decreases, swelling disappears, and pain subsides. A fistula remains from which pus is released for a long time. Its existence is supported by bone sequestrations. Sometimes they come out by themselves through the fistula channel. But of course, if patient have some problems, it's absolutely obvious that he need to address to the professional doctor because it's very dangerous. It's very dangerous. Okay. I guess we should end our lecture